Hi, everyone. Welcome to the CANPoint Point Prevalence Study Site Initiation Visit. My name is Marie-Hélène Masse, and I'm the Clinical Trial Manager of the CANPoint study. So today we will review the contacts, essential documents, study training, site activation, the objective and outcomes of the study, the flow chart of the study, the procedures, the CRF and the ECRF, the database, the definition of ICU and categories, few instructions for specific questions in the CRF, study reimbursement, and questions at the end. So here are the contacts of the study. So myself as the clinical trial manager, the research coordinators are Julie Ménard and Monica Sheen. They are both working with us here, and they will be in charge of the data, checking and validating the data entered in the database. And also, Julie Ménard is the contact person to send your essential documents. Joanie Martineau is our administrative assistant, so she's in charge of the payments. The principal investigators of the study are François Lamontagne and Neil Adhikari. And the other co-investigators of the study are Dr. Fuller, Dr. Murty, Dr. Ko, and Dr. Hébert. So 2 weeks ago, I have sent an email asking you to send us some documents before being able to activate your site for the study. So we need the protocol signature page signed. So you can find this protocol signature page on page 4 of the research protocol. We need a fully executed agreement, your REB and institutional approval, your delegation log completed and signed, and for the site investigator only, we need the Good Clinical Practice Certificate, so the GCP certificate, the CV and medical license, and by the way, the principal investigator must be a physician. So all these documents must be sent to Julie Ménard before March 26. So you can send these documents by email to Julie Ménard as soon as you have them all. Other essential documents that are needed, so for each person listed on the delegation log, they must have their GCP certificate, their CV, and a license if they have one. So for each person, you must keep these documents in your regulatory binder. So on site, you don't have to send these documents to us, but please make sure that you have everything in your binder. And today, the study training must be documented. So for each person listed on the delegation log, they must be trained on the study and prior to the first date of data collection. So as you know, we have a first date next week on March 31st. So in order to be activated, all the person listed on your delegation log must be trained on the study. So you must complete this document that you can find in the operation manual on the last page, and you must send it to Julie Ménard as soon as it is completed. So once you will have sent all your essential documents and completed your training and sent your training documentation to Julie Ménard, we will send you an email to confirm that your site is activated. And the people that will have access to the database, they will receive an email with their username and their password to access the database. So the objectives of the study are to advance the development of a learning system for critical care in Canada. So at the system level, we want to create a contemporary registry of level 1 to 3 ICUs across Canadian acute care hospital and determine occupancy rate at 3 time points during each calendar year. At the patient level, we want to determine the conditions and disease that define the burden of critical illness in patients admitted to these level 1 to 3 ICUs at each time point. At intervention level, we want to determine the resource-intensive interventions delivered to patients admitted to these level 1 to 3 ICUs at each time point. And at a research infrastructure level, we want to identify the ICUs that are able to collect and submit complete patient-level data to these point prevalence studies and the barriers encountered by non-participating ICU. The outcomes of the study are the ICU level and occupancy rate, the condition that define the burden of critical illness in patients admitted to Canadian ICUs, the resource-intensive interventions delivered to ICU patients, the capacity to participate to this point prevalence study, and barriers encountered by non-participating ICUs. So you have now a flow chart of the study. So actually we have funding for 1 year, but if we obtain more funding, we might continue this study over December 2025. So now at 3 specific dates per calendar year, we will collect data about ICUs in your hospital and patient hospitalized or awaiting ICU admission at 9 a.m. on the day of data collection. So as you know, the first time point of data collection is March 31st. We don't have the specific dates for time point number 2 and number 3, but we can tell you that time point number 2 will be during the summer and time point number 3 will be during the fall. We will announce these dates about a month before the date. So who should be included in the data collection? So all patients admitted to the ICUs of the participating sites must be included. We have sent invitation to all acute care hospitals across Canada, meaning that we sent almost 300 invitations. There are no exclusion criteria, and the data collection must be done for all patients in the ICUs and those who are cared for outside the ICU, so that are awaiting ICU admission and that are under the care of an ICU physician. So data will be collected at 9 a.m. So we mean that on March 31st at 9 a.m., the first thing that you will do is looking in your electronic medical record who is hospitalized in your ICU. So then you will collect the medical chart number of each patient in your master list. And then once done, you will start to collect data on each of these patients that you have listed in your master list. And please make sure to check in the emergency room or anywhere else in your hospital to make sure that if there are patients that are awaiting ICU admission and that are under the care of the ICU physician. So all data must be collected prospectively, so on March 31st. They can be collected on paper first, on the CRF PDF version first, and then entered in the REDCap database, or they can be entered directly in the REDCap database. This has to be done within the 7 business days. So we ask you to enter all the data of all the patients within the 7 business days. And then Julie and Monica will look at the data. They might put some queries for you. So please answer these queries as soon as possible. And we ask this to be done within 7 business days. So we have 2 versions of the CRF. So one is for adult and one is for pediatric patient. So you must use the age on the day of data collection. So if the patient is 18 and older, you must use the adult version. If the patient is below 18, you must use the pediatric version. You can find the CRF and the operation manual and also the protocol on the website of CANPoint. So these are always the last version of the documents. So you should make sure to look on the website to make sure that you have the last version. As soon as your site will be activated, you will receive an email with your username and your password and the link to access the REDCap database. And the first time that you will enter your first patient at each time point, you will have to answer a question. The question is in red at the bottom of the slide. So is it the first time that you answer questions about intensive care unit in your hospital? You will have to select yes. And then we will ask you how many ICUs you have at your hospital. So in this example, there are 4 ICUs. And for each of these 4 ICUs, you will have to answer a few questions about, you will have to enter a name for each ICU, the level, so level 1 to 3, and we will have some definitions for you. The population, so adult or pediatric, the number of staff of funded beds, and you will also have to tell us if you will collect data in each of these units. So we have develop or define what is in an ICU for this study. So we wanted to be more inclusive than usual. So according to this definition and the criteria below, you will have to review and confirm with your local principal investigator what is, so how many ICUs you have in your hospital. Since it is a study to mimic a pandemic, we wanted to be more inclusive, as I said, and some units that normally you don't consider as ICU might be considered as an ICU in this study. So please make sure to review this carefully. The definitions and the criteria are in the operation manual. If it's not clear, you can send us an email describing each of your units, and we can help you to define if it's if it should be included as ICU in this study. And the question that we will ask you is what distinguishes that unit from a regular ward bed at your site, and what distinguishes that unit from a straightforward ICU bed at your site. So, and we will ask you to define monitoring, patient-nurse ratio, the nurse expertise, the care given in this unit to help you define if it's an ICU or not. So please don't hesitate to send us an email with the information. And then you will have to, for each of the unit, define if they are level 1, 2, or 3. So again, this must be reviewed and confirmed with your principal investigator. The definitions are in the operation manual. So please refer to this in the operation manual. And for the research teams that have access to more than one ICU, please make sure to enter your patient in the right hospital. And if you want to switch from another, from an hospital to another, you have a blue button at the top of the page, which is blue, and you click on it and you will have the list of the sites that you have access to. Few instructions about the CRF. So we ask a question about gender and ethnicity. So we want you to record the ethnicity between the choice to select between the choices that we give you, only if the ethnicity or the gender is documented in the medical chart. So we don't want you to ask the patient or the nurse. You only take the information that is available in the medical chart. So if it's not available, you will answer to this question that it's not documented in medical record. That's it. Then the primary ICU diagnosis. So we want the diagnosis at ICU admission. And you must select the main reason for ICU admission. Then the baseline severity. So on page 3 of the CRF, we ask you to collect data on like the raw data of Apache or the Prisma score for pediatric version. So if the patient was admitted more than 7 days before, you don't collect these data. So for example, if the patient was admitted on March 23rd or before, you don't collect any of the data on page 3. About the interventions, so we want you to look on March 31st at 9 a.m. and look like the 24 hours prior to March 31st at 9 a.m. So between March 30 at 9 until March 31st at 9, did the patient receive ventilation, vasopressor, etc.? For the patient care for outside the ICU who are awaiting ICU admission, so please consider that the patient is in the ICU at the moment that he's under the care of the ICU physician. And if you enter a value outside the accepted range, a pop-up message will come up and they will ask you to confirm that the value is the right one that you want to enter. So study reimbursement, as you know, as per contract, you will receive a one-time fee of $1,000. Once your agreement will be fully executed, that you will have RAB and institutional approval. You will also receive $45 per chart collected. But I want to say it again. You must collect 100% of the patients that are hospitalized in an ICU. So if you said at the beginning of your data collection that you have 4 ICUs, that you will collect data in all of the 4 ICU, like all the patients must be collected in each of the 4 ICUs. We want you to enter the data within 7 days and answer the queries within 7 days as well. So we will send payments around mid-April because March 31st is the end of the fiscal year. So we will make sure to prioritize this in April, and you don't have to send any invoice. We will send you the payment with a document describing the payments. Thank you.